Welcome to our education session about advanced chronic kidney disease. This is Dr. Kadri, and I will be your narrator. The main purpose of our chronic kidney disease prevention clinic is to delay or prevent the progression of chronic kidney disease. We also feel it is extremely important to promote health and well-being in our patient population. Another priority is to prevent complications related to kidney and cardiac disease. In addition to this, preparing patients for renal replacement therapy is important if their kidney disease is advancing towards the need for this. Chronic kidney disease is defined as the presence of kidney damage or a reduction in kidney function for a period of at least 3 months or more. Chronic kidney disease can be divided into 5 stages, and the stage depends on the severity of damage or reduction in kidney function. The higher the stage, the worse the kidney function. There is usually no cure for chronic kidney disease. The goal of treatment is to keep the kidneys functioning as well as possible for as long as possible. It is important to learn about your treatment options early and plan ahead. Early on with chronic kidney disease, there are often no symptoms. As a patient advances through the stages of chronic kidney disease, they are more likely to get signs and symptoms of chronic kidney disease, such as high blood pressure, protein in the urine, and eventually symptoms develop in late stages of chronic kidney disease that may include fatigue, nausea, lack of appetite, and swelling. It is very important to note that the vast majority of people with chronic kidney disease do not experience any symptoms at all until kidney function declines to a very advanced stage. These symptoms generally appear when you have less than 15% of kidney function or you're in stage 5 chronic kidney disease. Symptoms may include fatigue and weakness, loss of appetite, weight loss, nausea and vomiting, shortness of breath and swelling, trouble concentrating or forgetfulness, and at times headaches or an altered taste in your mouth. It is important to know the things that you can do to control your chronic kidney disease. Most importantly, if you have high blood pressure or diabetes, you should try and control these conditions as well as possible. For most people, a target blood sugar will be between 5 and 7, and target blood pressure will be between 130 to 150 for your top number and 90 or less for your bottom number, depending on your age and other factors. In general, anti-inflammatory medications such as Motrin or ibuprofen should be avoided, whereas Tylenol would be a safer alternative for aches and pains. Avoiding dehydration is extremely important in keeping your kidney function stable. It is also extremely important to know that if you experience severe dehydration, such as a flu-like illness, lasting for 2 or more days, you should temporarily hold certain medications until you are feeling better and able to maintain your hydration. These medications include ACE inhibitors or angiotensin receptor blockers, often called ACE or ARBs, diuretics, metformin, and you should also know that if you're ever being considered for an angiogram that uses IV dye or a CT scan or MRI with the use of IV contrast, you should check with your kidney care team to make sure it is safe for you to undergo this procedure. Often, medication and hydration is needed to protect your kidneys prior to these tests being performed. As kidney function declines and nephrons, which are the filtering units in your kidneys, become damaged, kidneys no longer filter the blood as well. Harmful wastes and fluids can build up in your body. This may cause your blood pressure to rise. Your bone marrow may not be able to make enough red blood cells, and you may become anemic. It is possible that you may develop swelling or shortness of breath as kidney function declines as well. When you have chronic kidney disease, it is important to keep track of lab values for your healthcare practitioner as well as yourself. It is important that you know your baseline kidney function and whether you have had any history of problems with lab values as a result of your kidney function not being normal. Some of the important things for you to know are: which tests do you need regularly and what does each test measure? Why these tests are important to you and what happens when the results are out of range. Kidney function tests that we use to track your kidney function include your creatinine and urea levels, as well as an estimated glomerular filtration rate, or eGFR. Creatinine is a waste product from the normal breakdown of muscles in your body. It is removed by healthy, functioning kidneys, and the level in your blood is kept at a relatively low amount. If the kidneys are not working well, your creatinine level will rise. Changes in the creatinine level can help indicate how well the kidneys are functioning. The urea level is similar to the creatinine level. It is a byproduct of protein breakdown, and the kidneys normally clear this out of your blood. When the kidney function is not normal, your urea level will rise. The estimated glomerular filtration rate, or eGFR, is a formula used by the lab to determine how well your kidneys are functioning. It takes into account your age, gender, and race. A normal eGFR can range between 60 and 120. It is important to note that eGFR declines naturally with age, even in the absence of chronic kidney disease. If you have chronic kidney disease, your eGFR will decline more rapidly than based on age alone. The eGFR allows your physician to determine the stage of kidney disease you are at and when you may require renal replacement therapy. In the setting of chronic kidney disease, your ability to make blood in the bone marrow may be affected. The complete blood count is what we use to measure your red, white, and other blood cells. Your energy levels are dependent on having enough hemoglobin, which is present in your red blood cells. Hemoglobin carries oxygen and gives blood its red color, but also supplies that oxygen to your tissues. When the hemoglobin is too low, we call this anemia, which is common in advanced chronic kidney disease. On the left is a diagram of a normal amount of red blood cells, and on the right is what happens when you are anemic. You have a reduction in the amount of red blood cells, and there may be alterations in the shape and size of your red blood cells. In the setting of anemia, people may experience fatigue or loss of energy, feeling cold or pale skin, dizziness, trouble concentrating, headaches, and if severe, shortness of breath may occur. Although there are slight differences between men and women, a normal hemoglobin generally ranges between 115 and 150. If you have chronic kidney disease, our target is between 100 and 120 for your hemoglobin level. If you are below target, your kidney care team may order medications to try and help improve your hemoglobin level. Iron is essential to allow your bone marrow to make red blood cells. Two tests are used to measure the levels of iron in your blood, the ferritin and the transferrin saturation. A normal ferritin can range between 100 and 800 in chronic kidney disease patients. The transferrin level is generally normal if it is above 20%. Iron deficiency is common in patients with chronic kidney disease. Your healthcare provider will interpret your hemoglobin, your ferritin and transferrin saturation levels, and determine whether you have evidence of iron deficiency that warrants treatment. If so, supplements may be needed to replace iron stores. This can be taken orally or IV. Intravenous iron is generally more effective in patients with advanced chronic kidney disease. If your iron levels are relatively normal, yet you are still anemic in the setting of advanced chronic kidney disease, your healthcare provider may prescribe erythropoietin or EPO. This is a hormone made by healthy kidneys that helps the bone marrow to make red blood cells and hemoglobin. In chronic kidney disease, the kidneys do not make enough EPO to prevent your hemoglobin from dropping and making you anemic. Fortunately, we can give EPO therapy to chronic kidney disease patients to improve their hemoglobin and energy levels. This is generally given by subcutaneous injection. In the setting of chronic kidney disease, it is not uncommon to have electrolyte disturbances. The common electrolytes that may become abnormal in the setting of chronic kidney disease include potassium, phosphorus, calcium, and sodium. Potassium is important for heart, muscle, and nerve function. Phosphorus is important for your bone health. Calcium as well is important for bone health, as well as muscle and nerve function. Sodium is an important element that determines your fluid balance. In the setting of chronic kidney disease, potassium can become abnormally elevated. This is called hyperkalemia. Too much potassium in the blood can make muscles weak, including the heart, and this can lead to heart rhythm disturbances. Too low of a potassium can also occur, and this is called hypokalemia. This can cause fatigue and muscle weakness as well. This can be secondary to diuretic use or poor nutrition. As mentioned, potassium is critical for the normal functioning of muscles, heart, and nerves. In the setting of advanced chronic kidney disease, especially with the use of certain medications, it is not uncommon that patients develop high potassium levels. We are often asking patients to avoid high potassium containing foods such as bananas, oranges, tomatoes, potatoes, and chocolate. Better alternatives would include berries, apples, grapes, pineapple, watermelon, cucumbers, peppers, and peas in moderation. It is important to make sure that you are well hydrated with water to help flush potassium out of your body, as long as you don't have an increase in swelling. Certain medications may be reduced in dose or discontinued if potassium levels are persistently elevated. If your potassium level is severely elevated, you may be asked to go to the emergency room for more urgent treatment. In patients with chronic kidney disease, phosphorus levels may become elevated in the blood as your kidney function declines. Too much phosphorus is called hyperphosphatemia, and this can cause itchy skin and damage to your bones and other organs. A low phosphorus in the blood is called hypophosphatemia, and this can also lead to muscle weakness. The treatment of a high phosphorus level usually consists of reducing the phosphorus content in your diet, avoiding foods such as dark colas, beer, dairy products such as milk and cheese, dried fruits, bran and granolas, and whole wheat products. If needed, a phosphorus binder may be added, such as calcium carbonate or Tums Ultra, taken at the beginning of each meal to reduce the phosphorus absorbed from your diet. Calcium disturbances are also common in the setting of advanced chronic kidney disease. Too much calcium in the blood is called hypercalcemia, and this can cause nausea, confusion, weakness, and constipation, if severe. More often in chronic kidney disease, calcium levels are low because the kidneys normally make vitamin D to help you absorb calcium from your diet. Too little vitamin D can cause calcium to drop in your bloodstream. If severe, this can also cause confusion, muscle spasms, numbness, and in severe cases, seizures. Fortunately, this is rare. Most often, if your chronic kidney disease is advanced, you will need vitamin D therapy and at times oral calcium therapy as well. Calcium and phosphorus work together in your body to maintain the health of your bones. Sodium levels can be altered on occasion in patients with chronic kidney disease. Too much sodium in the blood is called hypernatremia, and this is usually a sign of severe dehydration and poor water intake. Too little sodium in the blood is called hyponatremia. This is often due to diuretic therapy. Too little sodium in the blood can cause muscle cramps, nausea, and on occasion, seizures. With advanced chronic kidney disease, because vitamin D and calcium levels can be low, the parathyroid glands in your neck can become overactive. They produce a hormone called parathyroid hormone that helps control the level of calcium in your blood. The parathyroid glands start to produce more parathyroid hormone when vitamin D levels are low, and this pulls calcium out of your bones and into the blood to help normalize your levels. If parathyroid hormone levels rise beyond a certain point, vitamin D therapy would be necessary to help settle the function of these glands down so that your bones can remain healthy. As mentioned, the parathyroid glands are located in your neck. There are 4 glands, 2 on each side, embedded within your thyroid gland. When the parathyroid gland becomes overactive with advanced chronic kidney disease, vitamin D therapy is often necessary. At times, though, this is not enough, and in some patients, surgery is necessary to remove these very overactive glands in order to protect your bone health long term. In chronic kidney disease patients, particularly as the level of kidney dysfunction worsens, your nutritional status becomes very important. Albumin is a blood protein that we measure as an indicator of a patient's level of nutritional status. A normal range is between 35 and 50. If the albumin is depressed significantly below that, nutritional supplements may be needed, as well as encouraging good protein intake in your diet. The better a kidney patient's nutritional status is, the better they do in the setting of their chronic kidney disease. If you have advanced chronic kidney disease, it will be very important for you to regularly have your blood work checked and attend clinic visits. The reason this is important is to ensure that your lab work results stay within acceptable ranges and to ensure there are no complications of your chronic kidney disease. Often with screening lab work, complications can be detected at an early stage and treated promptly to avoid any consequences on your long-term health. Stage 5 chronic kidney disease is the final stage of chronic kidney disease before requiring renal replacement therapy. People in stage 5 chronic kidney disease may still not be experiencing any symptoms at all. This is why it is very important to prepare for the possibility of needing renal replacement therapy well in advance of needing it. We generally start educating people about chronic kidney disease when they are in stage 4. Well before they are likely to develop any symptoms at all. People can stay in stage 4 and in stage 5 chronic kidney disease for quite some time without needing renal replacement therapy. Education during these stages is important, and a decision about the type of renal replacement therapy a patient would like is important to have completed well in advance. This allows appropriate preparation to take place so that the transition can be smooth and relatively effortless on the part of the patient as well as healthcare practitioners. This program has been supported by the Care for Kidneys Foundation.